Periodontal disease is an infection of the tissues that support the teeth. In case of periodontal disease, the gums and the bone holding the teeth recede, exposing the tooth roots. The gums turn red and swollen. Biting exerts additional pressure on already weak and mobile teeth, making them more mobile. Eventually, in periodontal disease, the tissues supporting the tooth break down and teeth fall. Occasionally during extraction, the tip of the root of the tooth can break. Attempts to retrieve it with elevators, it can actually dislodge into the sinus with thin floor. The flaps are exposed. Access opening is made in the bone. Incision is made in sinus membrane. High vacuum suction tips placed in sinus area to suck the root tip. It can then be pulled out through the access window created. A resorbable membrane can be used to repair the cut. It is placed into the access window. The flap is now replaced. The socket in most cases will heal and fill in on its own. If the wisdom tooth has erupted out of the jaw bone, but not through the gum line, it is called a soft tissue impaction. Gingiva above the impacted tooth is flapped. With help of the root elevator, the tooth is dislodged. The gums are sutured back. Subgingival bacteria accumulation causes plaque. If left undisturbed, the bacterial plaque calcifies to form calculus. Calculus causes irritation to gums and bone. The bone moves away from it, further creating deeper subgingival pockets, giving additional home to calculus. This vicious cycle continues unless the calculus is treated. When the root of a tooth is exposed due to gum recession, it can be covered by lateral pedicle graft if there is adequate bone and thick gingival tissue on the adjacent teeth. Using a scalpel, a small part of the edge of the defect is removed. Relieving incisions are made on either side. The pedicle flaps are now brought together to cover the recession and defects. They are sutured in place. The area is covered with protective periodontal dressing to promote healing. Once healed, the dressing is removed. The area will heal on its own, and with passage of time the exposed connective tissue will be covered with attached gingiva.